You just mentioned about that through the MRI spectroscopy, we can detect osteoporosis and precisely even. What I want to ask you, is there any parameters or criteria in the regular MRI that we have in our clinic, accidentally, and you say something like, this is suspected to be an MRI for an osteoporotic patient, so you go more and more, whether for DEXA, for MRI spectroscopy?
Yes, actually, this is a nice question, because I was about to when we are doing bone scan, you are asking about when we are doing bone scan by technician for the whole skeleton, can we suspect the presence of osteoporosis? Yes, we can, if we get what we call a bad uptake or low uptake, because the bone mineral density is low, and the uptake of the bone for the nuclear substance of the technetium is low. So we get a low uptake of the skeleton and the image is poor. So we may suspect the presence of osteoporosis. And this is very important to differentiate it from osteomalacia. As I mentioned, the DEXA examination cannot differentiate between osteomalacia and osteoporosis. Both of them produce low bone mineral densities. But by the use of nuclear medicine or bone scan, we can definitely differentiate. One can give us a very good or strong uptake, what we call it super scan in osteomalacia, and the other one get very low uptake and bad images for the skeleton. So osteomalacia and osteoporosis can be very easily differentiated by the nuclear medicine and technetium bone scan, although they produce the same low BMD index.
But in regular MRI, there is no anything that make us suspicious. In the regular MRI, whether T1 or T2.
Right. In MRI, regular MRI, you cannot differentiate unless you use spectroscopy.
Dr. Mohammed.
Thank you, Dr. Emil. Believe me, I feel I am in a very big dilemma, because we are facing a lot of problems. We are talking about life expectancy. It doesn't mean anything. I am living until 70 or 80 with many diseases like diabetes, hypertension, dyslipidemia, etc. In WHO, we have an indicator called health expectancy. How many days I am living in a good condition. And we have two indicators, the QALY and DALY. QALY, it means the quality adjusted life per year. How many days I am living in a good condition. Now, my comment regarding why we are using one machine for follow-up. As you know, the technology now is growing up. Every day we have new devices, new machines. And it was mentioned when the technology master, it means we are going faster to disaster. So as a physician, how I cope with the technology, how I cope with the new devices, how I interpret and read the T-score. And the T-score, is it changeable from time to time? So we have to identify something called action-oriented. We have to invite the politicians, the educational people to participate actively with us. We have also to invite the decision makers. It doesn't mean anything. We have to repeat what we are saying in every workshop and in every conferences. What about the other people? We are isolated now. So we have to invite them. 2 weeks ago, they discovered they are using the horse meat in burger. And the horse meat, it contains biron. It is a foreign protein which creates the mad cow disease. And it contains a lot of urate in the meat. So how to deal with this? This is my question.
I'll answer one thing about life expectancy. I was in Vienna 2 weeks ago in the Bonn Academy, and a geriatrician from Newcastle in England, he said, every day you wake up and you're still alive, your life expectancy have increased by 5 years. I don't know if this is true or not, but at least it's an additive value. Concerning the horse meat, it was not only horse, it was horse and donkeys, unfortunately. And it was in Romania, and I think it was exported to Europe. And it's a health hazard, but thank God they discovered it. So I think what concerns now the medical profession is frailty and sarcopenia, which occurs with old age, people stopping exercising and walking, and they are bound to fall, and when they fall, they fracture. And there's a new terminology coming now, which is sarcoporosis, which is sarcopenia plus osteoporosis. So I think we are living longer than expected. And there was nothing done to predict, especially in our area here. In Japan, they have done this before, and to the extent that they live longer now than 90 years. And they have initiated a ministry they call the Ministry of Leisure Time, because those people, when they get old, they are not working, they get fed up, and they commit suicide very easily. So they want to help them to lead a healthy life. So I think the era is coming where we are going to have what they call a geriatric boom all over the world. And I think we should be prepared for that.
Any more questions?
Thank you for a question, a basic science question. I'm Dr. Samurai from Emergency. Just out of wonder, you know, vitamin D is related to osteoporosis and osteomalacia. Now, why some patients with vitamin D deficient develop osteomalacia, the others develop osteoporosis? It's actually a question of my son. He's a medical student, and he was asking me that question. I was not able to answer it. I looked here and there, I didn't find a very clear answer. Why a vitamin D patient? Some of them, they go for osteoporosis, the others go for malacia. It's a basic science question, thank you.
It depends on the age. When you are vitamin D deficient at childhood, you get rickets. When you are a female, childbearing period, and you have many babies, and breastfeeding, which is happening now in our area, they keep feeding the children for 2 years. And there is every baby that mother is losing every day almost 500 milligrams of calcium. If she's not taking enough calcium, she will have, and enough vitamin D, she will have hyperparathyroidism, and hyperparathyroidism will lead to osteomalacia, and the only way to correct it is to give high amounts of vitamin D and calcium. The other thing, if you are a male, you can develop what we call now osteoporomalacia. You have a combination of the two, osteoporosis and osteomalacia, and I see this in my patients with rheumatoid arthritis. To the extent now I'm doing a routine in my clinic for every patient I see with rheumatoid arthritis, irrespective of being male or a female, a PTH, which is an indicator of vitamin D deficiency or insufficiency. In our area, we are vitamin D insufficient, almost 80% of the population. We've done a study in Egypt about this. So it depends on the age, and at the same time, your sun exposure, your vitamin D level, and eventually you can get osteoporosis, osteomalacia, and osteoporomalacia at the same time, or rickets.
Any more questions?
I think people are hungry and they want to eat, and they are fed up with the speakers, to a certain extent. So there is a question. You can just hold.
It's too late. He's too late.
Just hold on for a second. We have a question there. The entire generation has to ask. Go ahead. Can you have the microphone there?
My question is to Dr. Renate. She mentioned something about the correlation between diabetes and the osteoporosis. First of all, we'd like to come here in Bahrain, enjoy the sun. And thank you for that wonderful speech. I'm Samir El Badawy, the Vice President of Medical Research Society in Bahrain. We are doing one research, and I would like to suggest and ask one question. I'll start with the question and then answer the question. Do you think, Dr. Renate, if we implement policies to increase the number of gyms in villages, cities, or refer patients, diabetic patients to exercise centers, do you think that's a valid option to reduce the diabetes of the diabetic patient, the number of diabetic patients? That's my first question. And now that's the suggestion. Or do you want to answer and then answer that?
Really, I cannot understand anything, Renate. I'm sorry. No.
I think he's asking about if you suggest to get the places
I mean,
diabetics.
repeat my question.
Can you repeat it slowly?
Acoustical problems.
Okay.
It was so long. It was such a long question. I can't remember it. I'm too old. Could you summarize?
Yeah.
Could you summarize it? Diabetes in the big cities?
No, I mean, do you think if we implement policies, suggesting implementing policies to increase the number of gyms?
Gyms?
Or gyms?
Gyms, okay.
Yeah, gyms. Or exercise centers in the villages or in the cities.
Okay, I understand.
As a medical center for diabetic patients, do you think that will reduce the number of diabetic patients?
Sure, it doesn't, not only gyms, it's just exercise, movement, wherever you can move. I show you the escalator, it's just movement. When you walk to the post box, when you go to a restaurant and not take the car, that's exercise. And gyms would be the best. I know that you here the sun is very hot and you can go jogging because you get a sunburn maybe jog. But in our country we have a little sun and people could move, could walk, could jog, but they don't do it. So when you bring the patient in gyms, it's wonderful. And the state should do a lot of efforts to make our patients move. You're right, we would reduce diabetes, but we have to start in childhood. We have to start with our kids in the kindergartens. We have to start in the schools. You're right.
I mean, making the gym as a treatment option as a management, do you think that would be a valid option? Going to the gym as a management option besides the drugs. So we give the patient 3 days to go to the gym, and it's all that obligatory for them.
Would be wonderful. Would be wonderful. Would be a great option, and if we should do it, would be great.
Here in Bahrain, the Ministry of Health did a great job. They built many walking squares in France. But also, in Bahrain, some studies show that we became the second in the ranking of diabetic communities. So,
That happens. I think
One
that
second.
happens.
do you think if we go ahead and start doing that in one city of this big world, will that city be the pioneer of that mission program? I mean, implementing medications.
Yes.
Sure, of course, would be great.
Why don't we do it for real here in Bahrain? So let's start. Anyway, thank you so much. Thank you so much.
Thank you very much. We will meet again after lunch.